1. What is the most common side effect to monitor for in a patient starting lisinopril for hypertension? Answer: dry, persistent cough. Rationale: lisinopril, an ACE inhibitor, commonly causes a dry cough due to increased bradykinin levels. Patients should be monitored and alternative medications, e.g. ARBs, considered if the cough is intolerable. 2. What is the priority nursing action when a patient receiving warfarin has an INR of 5.2? Answer: hold the warfarin dose and notify the healthcare provider. Rationale: an INR of 5.2 indicates excessive anticoagulation, increasing bleeding risk. Holding the dose and notifying the provider allows for interventions like vitamin K or dose adjustment to prevent hemorrhage. 3. What is the most critical adverse effect to monitor for in a patient taking metformin? Answer: lactic acidosis. Rationale: metformin can rarely cause lactic acidosis, a life-threatening condition, particularly in patients with renal impairment or hypoxia. Symptoms like muscle pain or respiratory distress require immediate intervention. 4. What is the primary nursing intervention for a patient experiencing extravasation of a vesicant chemotherapy drug? Answer: stop the infusion immediately and aspirate residual drug from the foresite. Rationale: extravasation of vesicant drugs can cause severe tissue necrosis. Stopping the infusion and aspirating residual drug minimizes damage, followed by antidote administration and provider notification. 5. What lab value should a nurse monitor in a patient receiving heparin therapy? Answer: activated partial thromboplastin time, APTT. Rationale: heparin's anticoagulant effect is monitored via APTT to ensure therapeutic levels, 1.5 to 2.5 times control, and prevent bleeding or clotting complications. 6. What is the most important action to take before administering digoxin to a patient with heart failure? Answer: check the patient's apical pulse for a full minute. Rationale: digoxin can cause bradycardia or arrhythmias, especially in toxicity. Holding the dose if the pulse is below 60 bpm or per facility policy prevents adverse cardiac effects. 7. What is the primary patient education point for a patient prescribed nitroglycerin for angina? Answer: take up to 3 doses 5 minutes apart if chest pain persists, then seek emergency care if no relief. Rationale: proper nitroglycerin use involves sublingual administration every 5 minutes for up to 3 doses. Patients must call 911 if pain persists to prevent myocardial infarction. 8. What is the most critical side effect to monitor for in a patient receiving vancomycin? Answer: nephrotoxicity. Rationale: vancomycin can cause kidney damage, especially with high trough levels, greater than 20 micrograms per milliliter. Monitoring serum creatinine and trough levels ensures early detection and prevention of renal injury. 9. What is the primary nursing action when a patient on furosemide reports muscle cramps? Answer: assess serum potassium levels and notify the healthcare provider. Rationale: furosemide, a loop diuretic, can cause hypokalemia, leading to muscle cramps. Checking potassium levels and reporting findings allows for timely supplementation or dose adjustment. 10. What is the most common side effect of opioid analgesics like morphine? Answer: constipation. Rationale: opioids slow gastrointestinal motility, commonly causing constipation. Nurses should educate patients on preventive measures like increased fiber intake and consider laxatives as prescribed. 11. What lab value should be monitored in a patient taking acetaminophen long-term? Answer: liver function tests, ALT-AST. Rationale: long-term acetaminophen use can cause hepatotoxicity, especially at high doses. Monitoring liver enzymes detects early liver damage, prompting dose adjustment or discontinuation. 12. What is the priority nursing action for a patient experiencing serotonin syndrome while on fluoxetine? Answer: discontinue fluoxetine and notify the healthcare provider immediately. Rationale: serotonin syndrome, caused by excessive serotonin, e.g., from SSRIs like fluoxetine, is life-threatening. Stopping the drug and notifying the provider allows for supportive care and symptom management. 13. What is the most critical adverse effect of aminoglycosides like gentamicin? Answer: ototoxicity. Rationale: aminoglycosides can cause irreversible hearing loss or balance issues. Nurses should monitor for tinnitus, vertigo, or hearing changes and report symptoms promptly. 14. What is the primary patient education point for a patient starting levothyroxine for hypothyroidism? Answer: take the medication on an empty stomach in the morning. Rationale: levothyroxine is best absorbed on an empty stomach 30 to 60 minutes before breakfast to ensure consistent therapeutic levels and avoid interactions with food or other drugs. 15. What is the most important action before administering insulin to a patient with diabetes? Answer: verify the blood glucose level. Rationale: checking blood glucose ensures insulin administration is appropriate, preventing hypoglycemia or hyperglycemia. The dose may need adjustment based on the reading. 16. What is the most common side effect of antihistamines like diphenhydramine? Answer: drowsiness. Rationale: diphenhydramine, a first-generation antihistamine, causes sedation due to its central nervous system effects. Patients should be cautioned against driving or operating machinery. 17. What is the priority nursing action for a patient with a lithium level of 2.5 milliequivalent/L? Answer: hold the lithium dose and notify the healthcare provider. Rationale: a lithium level above 1.5 milliequivalent/L indicates toxicity, risking seizures or coma. Holding the dose and notifying the provider allows for urgent interventions like hydration or dialysis. 18. What is the most critical side effect to monitor for in a patient taking prednisone long-term? Answer: osteoporosis. Rationale: long-term corticosteroid use like prednisone reduces bone density, increasing fracture risk. Nurses should monitor bone health and educate patients on calcium/vitamin D supplementation. 19. What lab value should be monitored in a patient receiving statins like atorvastatin? Answer: liver function tests, ALT/AST. Rationale: statins can cause hepatotoxicity. Regular monitoring of liver enzymes detects early liver damage, allowing for dose adjustment or discontinuation if needed. 20. What is the primary nursing action for a patient experiencing an anaphylactic reaction to penicillin? Answer: administer epinephrine immediately and notify the healthcare provider. Rationale: anaphylaxis is a life-threatening allergic reaction requiring immediate epinephrine to reverse bronchoconstriction and hypotension, followed by provider notification for further management. 21. What is the most common side effect of beta blockers like metoprolol? Answer: bradycardia. Rationale: beta blockers reduce heart rate by blocking sympathetic stimulation. Nurses should monitor pulse and hold the dose if bradycardia occurs, per facility policy. 22. What is the priority patient education point for a patient prescribed albuterol for asthma? Answer: rinse the mouth after inhalation to prevent oral thrush. Rationale: albuterol inhalers, especially when used with corticosteroids, can increase the risk of oral candidiasis. Rinsing the mouth after use reduces this risk. 23. What is the most critical adverse effect of chemotherapy drugs like cisplatin? Answer: nephrotoxicity. Rationale: cisplatin can cause significant kidney damage. Monitoring serum creatinine and ensuring adequate hydration are essential to minimize renal toxicity. 24. What is the primary nursing action when a patient on NSAIDs reports black, tarry stools? Answer: notify the healthcare provider immediately. Rationale: black, tarry stools suggest gastrointestinal bleeding, a serious NSAID side effect. Prompt notification allows for diagnostic evaluation and discontinuation of the drug if needed. 25. What is the most important lab value to monitor in a patient taking spironolactone? Answer: serum potassium. Rationale: spironolactone, a potassium-sparing diuretic, can cause hyperkalemia. Monitoring potassium levels prevents arrhythmias or other complications from elevated potassium. 26. What is the most common side effect of calcium channel blockers like amlodipine? Answer: peripheral edema. Rationale: amlodipine can cause vasodilation, leading to fluid accumulation in the extremities. Nurses should monitor for edema and educate patients to report swelling. 27. What is the priority nursing action for a patient with a phenytoin level of 25 micrograms per milliliter? Answer: hold the phenytoin dose and notify the healthcare provider. Rationale: a phenytoin level above 20 micrograms per milliliter indicates toxicity, risking ataxia or seizures. Holding the dose and notifying the provider allows for dose adjustment or alternative therapy. 28. What is the most critical side effect of isoniazid in tuberculosis treatment? Answer: hepatotoxicity. Rationale: isoniazid can cause liver damage, especially in patients with pre-existing liver conditions. Monitoring liver function tests and symptoms like jaundice is essential. 29. What is the primary patient education point for a patient starting warfarin? Answer: avoid sudden changes in vitamin K-rich food intake. Rationale: warfarin's anticoagulant effect is influenced by vitamin K. Consistent dietary intake of foods like leafy greens prevents fluctuations in INR and bleeding or clotting risks. 30. What is the most common side effect of SSRIs like sertraline? Answer: sexual dysfunction. Rationale: SSRIs commonly cause sexual side effects like decreased libido or erectile dysfunction. Nurses should educate patients and discuss potential management strategies with the provider. 31. What is the priority nursing action for a patient experiencing tardive dyskinesia while on haloperidol? Answer: notify the healthcare provider immediately. Rationale: tardive dyskinesia, a potentially irreversible movement disorder, is a serious side effect of antipsychotics like haloperidol. Prompt notification allows for drug discontinuation or adjustment. 32. What is the most critical adverse effect of ACE inhibitors in patients with renal artery stenosis? Answer: acute kidney injury. Rationale: ACE inhibitors can reduce glomerular filtration in renal artery stenosis, causing acute kidney injury. Monitoring renal function and avoiding these drugs in such patients is critical. 33. What lab value should be monitored in a patient receiving amphotericin B? Answer: serum creatinine. Rationale: amphotericin B is highly nephrotoxic. Monitoring serum creatinine detects early kidney damage, allowing for dose adjustment or alternative antifungal therapy. 34. What is the primary nursing action for a patient with hypoglycemia while on insulin? Answer: administer 15 grams of fast-acting carbohydrates. Rationale: hypoglycemia, blood glucose is less than 70 milligrams per deciliter, requires immediate treatment with 15 grams of fast-acting carbs, e.g., juice or glucose tablets, followed by rechecking glucose after 15 minutes. 35. What is the most common side effect of tricyclic antidepressants like amitriptyline? Answer: anticholinergic effects, dry mouth, constipation. Rationale: tricyclics block acetylcholine, causing dry mouth, constipation, and blurred vision. Nurses should educate patients on symptom management like hydration or fiber intake. 36. What is the priority nursing action for a patient with a theophylline level of 30 micrograms per milliliter? Answer: hold the theophylline dose and notify the healthcare provider. Rationale: a theophylline level above 20 micrograms per milliliter indicates toxicity, risking seizures or arrhythmias. Holding the dose and notifying the provider allows for urgent intervention. 37. What is the most critical side effect of methotrexate in rheumatoid arthritis treatment? Answer: bone marrow suppression. Rationale: methotrexate can cause leukopenia or thrombocytopenia, increasing infection or bleeding risks. Monitoring complete blood counts, CBC, is essential for early detection. 38. What is the primary patient education point for a patient prescribed tetracycline? Answer: avoid sun exposure and use sunscreen. Rationale: tetracycline causes photosensitivity, increasing sunburn risk. Patients should use sunscreen and protective clothing to prevent skin damage. 39. What is the most common side effect of benzodiazepines like lorazepam? Answer: sedation. Rationale: benzodiazepines cause central nervous system depression, leading to drowsiness. Nurses should caution patients against driving and monitor for excessive sedation. 40. What is the priority nursing action for a patient with a potassium level of 2.8 milliequivalent/L before digoxin administration? Answer: Hold the digoxin dose and notify the healthcare provider. Rationale: hypokalemia increases digoxin toxicity risk, causing arrhythmias. Holding the dose and notifying the provider allows for potassium correction before administration. 41. What is the most critical adverse effect of tamoxifen in breast cancer treatment? Answer: endometrial cancer risk. Rationale: tamoxifen, a selective estrogen receptor modulator, increases the risk of endometrial cancer. Nurses should educate patients to report abnormal vaginal bleeding promptly. 42. What lab value should be monitored in a patient taking clozapine? Answer: white blood cell count, WBC. Rationale: clozapine can cause agranulocytosis, a life-threatening drop in WBCs. Regular WBC monitoring is required to detect this side effect early and prevent infections. 43. What is the primary nursing action for a patient experiencing Stevens-Johnson syndrome while on lamotrigine? Answer: discontinue lamotrigine and notify the healthcare provider immediately. Rationale: Stevens-Johnson syndrome is a severe, potentially fatal skin reaction. Stopping lamotrigine and notifying the provider ensures urgent supportive care and alternative therapy. 44. What is the most common side effect of loop diuretics like furosemide? Answer: hypokalemia. Rationale: furosemide increases potassium excretion, leading to hypokalemia, which can cause muscle cramps or arrhythmias. Monitoring potassium levels is essential. 45. What is the priority patient education point for a patient starting allopurinol for gout? Answer: drink plenty of fluids to prevent kidney stones. Rationale: allopurinol can increase uric acid excretion, risking kidney stone formation. Adequate hydration helps prevent this complication. 46. What is the most critical side effect of beta-2 agonists like salmeterol? Answer: tachycardia. Rationale: beta-2 agonists stimulate the heart, potentially causing tachycardia. Nurses should monitor heart rate and educate patients to report palpitations. 47. What is the primary nursing action for a patient with a morphine overdose? Answer: administer naloxone and monitor respiratory status. Rationale: morphine overdose causes respiratory depression. Naloxone reverses opioid effects, and monitoring ensures airway protection and adequate ventilation. 48. What is the most common side effect of proton pump inhibitors like omeprazole? Answer: vitamin B12 deficiency, long-term use. Rationale: long-term omeprazole use reduces gastric acid, impairing B12 absorption. Nurses should monitor for symptoms like fatigue and educate patients on supplementation if needed. 49. What lab value should be monitored in a patient receiving cyclosporin? Answer: serum creatinine. Rationale: cyclosporin, an immunosuppressant, is nephrotoxic. Monitoring serum creatinine detects early kidney damage, allowing for dose adjustment or alternative therapy. 50. What is the priority nursing action for a patient experiencing dystonia while on risperidone? Answer: administer an anticholinergic like benztropine and notify the healthcare provider. Rationale: dystonia, an extrapyramidal side effect of antipsychotics like risperidone, requires immediate anticholinergic treatment to relieve muscle spasms, followed by provider notification for further management.